Hey everyone, thanks again for joining us. Just wanted to talk today about something non-peptide related. We want to talk about some updates that have been happening in women's health as it relates to two products. One is a product that I think is really, really exciting. It's called oxybutynin. Um, One traditional thing we run into in the realm of hormone replacement is how do you manage hot flashes for menopausal women without using hormones, particularly those, breast cancer survivors or those with a history of blood clots. And there was a really good study that was actually published in mid-December, so December 15th, which talks about oxybutynin chloride as a way to diminish hot flash activity that is safe for those patient populations. So I'll be posting this and sending out the link to the study which is just published. But what they essentially did is they looked at this oral product, and oxybutynin is actually not a new product. It's been around since the 1970s and was originally and still has been used for bladder incontinence. So this has sort of been repurposed, and for years actually, it's actually been studied in hormone management, and particularly hot flashes, as it's an anticholinergic agent. And that sort of helps these neurotransmitters by reducing spasms in the muscle cells, which are located within the blood vessels, and reducing that sweating, reducing sort of the hot flash sensation. And so it's also used for hyperhidrosis or profuse sweating. But this study that actually came out showed that at several different concentrations, it was able to reduce the incidence of hot flashes and be an option for hormone replacement therapy. So definitely something to roll out. The article that I'll be posting actually had two objectives. One was a dose response evaluation of oxybutynin, determine the toxicity as well as sort of measuring quality of life. And the good news is that on both doses of what they studied of oxybutynin, they measured overall improvements in quality of life, specifically within sleep, work, leisure activities, and social activities. So all those things are really, really good. The other thing to definitely take note of is that dry mouth can be a result of this. You wouldn't want to use it with anyone with narrow angle glaucoma. And most importantly, long-term use can result in some cognitive-related side effects. So definitely something to be aware of. But hopefully, this gives you another tool in sort of the booklet for hormones. The other thing that was really, really exciting is that there was sort of a really, really large meta-analysis published on December 17th in regards to female vaginal estrogen treatment. And of course, most of you all know vaginal estrogen is superior to oral in relieving the menopausal discomfort associated, with sort of dry mucous membranes as a result of sex. And this is traditionally a therapy that's been neglected pretty heavily because vaginal estrogen was sort of put on the back burner when the FDA issued a black box warning in 2003 that alerted women to increased risk of heart disease, myocardial infarction, stroke, and breast cancer with vaginal estrogen. And since then, there have been several studies which have refuted this, and I think everyone in our community definitely knows. But there's a really good meta-analysis study that if anyone wants to sort of point to, they can definitely point to this study as sort of dispelling that myth. And this study sort of looked at, and this is sort of a quote, association between vaginal estrogen use and multiple health outcomes, including cardiovascular disease, myocardial infarction, stroke, pulmonary embolism, cancer, and whether that be invasive breast, endometrial, ovarian, colorectal, and hip fracture. So it was a really, really good meta-analysis. And the findings from this group were extremely positive. They showed that vaginal estrogen was not associated with a higher risk of cardiovascular disease or cancer, and it's really a highly effective treatment for genital urinary symptoms of menopause. The other thing that's important to note is they highly recommended this along with a concert of other items. Particularly, they recommended vaginal estrogen, intravaginal DHEA, and oral. And we'll be linking both of these studies, but these are two developments in just the month of December as it relates to hormone therapy in women. So definitely take a look at those, and hopefully these can be added, an added tool for you to treat hot flashes, and then just again some literature and some evidence to support the use of vaginal estrogen. All right, thanks.